All right, so with that, thank you so much for making it to the UUCD forums this morning. We are lucky to have We Clinic with us, and presenting will be Laurie Casey. And I'll do a quick introduction of Laurie and a little housekeeping reminder of how to participate, and then we'll jump right in. I am just going to mute all lines so that we don't have any dogs barking in the background or distractions. But you're welcome to unmute when we get to Q&A. In the meantime, if you have any questions, please feel free to put them in the chat and we can ask them if they are helpful to clarify what Laurie's talking about as we go through things. A little bit more about Laurie. Laurie's been a We Health Clinic staff member since it was established in 1981 and became the executive director in 2008. She's worked for 40 years to reduce barriers and keep access open for reproductive healthcare services for populations in northeastern Minnesota, northern Wisconsin, and the Upper Peninsula of Michigan. Laurie graduated from the University of Minnesota-Duluth with a degree in community health education and oversees the clinic operations, finances, fundraising, planning, and community relations, in addition to co-managing the Building for Women as a general partner. Laurie has been a participating member of the National Abortion Federation, Minnesota NARAL, Abortion Care Network, and Reproductive Health Alliance. We are so honored to have you back, Laurie, and we are going to have the floor is yours and have a wonderful presentation ahead here, everyone. Thanks for being here.
Thank you. Well, first of all, thank you for inviting me. I look forward to this every year, and it's just a great opportunity to let people in the community know about our services and just what we do. And this is especially important this year because we are 40 years old. We never would have thought we would have been here 40 years, but we're so glad we are. We opened the clinic the first week of April of 1981. So this year we had hoped to have a celebration to celebrate our milestone, but you know, with COVID, we don't know. We're looking at maybe an in-person celebration towards the end of the summer, early fall, but we'll have to see how everything goes. So thank you for inviting me, and I'll just start. So at the beginning, Midwest Health Center for Women was a clinic in Minneapolis, and they were established in 1975, and they were the first nonprofit abortion clinic in Minnesota. And so the co-directors for that clinic were Robert McCoy and Renee Ward, and their medical director was Jane Hodgson. And so they saw a need to establish a clinic in Duluth because they saw quite a few women from northeastern Minnesota, northern Wisconsin, traveling down to Minneapolis to get an abortion. And they knew that safe abortion was difficult to obtain for many women, and it really affected the women that lived in rural areas. So in 1980, 98% of all abortions performed in Minnesota were done in the Twin Cities, and 55% of all these women were outside of the metro area. So that's a big number of women that were traveling to the cities. And then also, this is just a little fact from Unrestrict Minnesota, that less than 5% of Minnesota counties have abortion clinics that provide abortion care. So currently, right now, there's Planned Parenthood in St. Paul, Whole Women's Health in Bloomington, Robbinsdale Clinic in Robbinsdale, and then our clinic. Those are the only places that perform abortions in Minnesota. And when we first opened, Midwest Health Center for Women was in operation, and then and Meadowbrook. So a few of the clinics have closed over the years also. So Midwest saw a need to expand abortion in northeastern Minnesota. And so their objectives were to provide abortion services locally on an outpatient basis for low cost. Also to decrease the risk of complications due to follow-up difficulties encountered by the provider or patients resulting in distance from the provider. So, you know, they didn't want to see women traveling back down to Minneapolis if they had a problem, if they didn't have to. So that's also one of the reasons why they wanted to establish a clinic in Duluth. And then also, again, to decrease transportation problems and travel expenses to the Twin Cities, because a lot of women, you know, don't have vehicles, and it also was expensive to travel down to the cities. And then also to increase the awareness and ensure the availability of freedom of choice for pregnant women in northeastern Minnesota and northern Wisconsin. So the funding to establish our clinic came from a few different places. Midwest Health Center for Women received a 3-year grant from the McKnight Foundation. And so the total budget was $539,740, which was probably quite a lot back in 1981. So the McKnight Foundation put in money. Midwest Health Center for Women took money from their own clinic fees, and then patient fees were expected to make up the rest of the difference. And so our clinic was supposed to be self-sufficient in the 4th year of operation. So then we would break away, and actually we met that milestone 3 years after we were established. So we became Women's Health Center. Then in it must be 1983, maybe we met it earlier. And then in 1981, Tina Welsh was hired as the clinic director, and Dot Gallagher was hired as a nurse practitioner. And then we hired 3 patient educators, a nurse, it was Ruthie Frederick, the front desk person, which was myself, and then Barb Como and Kathy Hessen were hired as lab techs in March of 1981. So our first clinic day, and the days that we do abortions, we call those clinic days. It was the first week of April of 1981. And so we were one of 2 abortion providers in St. Louis County, because the other abortion provider was Dr. William Lundberg, who worked at Duluth OBGYN. So when he saw that we were opening a clinic in Duluth, he probably sighed a big sigh of relief, because then he didn't have to put up with all the harassment, the negativity, and his practice didn't have to put up with that. So he referred, and his practice referred quite a few women to our organization. And an abortion in 1981 cost $200. Currently it costs $700. So there's been a $500 increase over 40 years, which probably isn't a great significant amount considering how much healthcare has increased over the years. So the first year that we were in operation, we provided family planning services and abortions to 2,200 women in St. Louis County, and 1,129 of those appointments were actual abortions. So in 1980 or 1981, there was 1,048 abortions performed in St. Louis County compared to 450 in 1980. So those 450 abortions were what Dr. Lundberg did, and also Dr. Van Ryzen did a few abortions also. And so we did 843 of the 1,048 abortions at our clinic in Duluth from March 1st of 1981 through February 28th of 1982. And then in August 1st, 1981, the parental notification law went into effect, and that required notifying both biological parents that their daughter was terminating their pregnancy. But we also sued the state of Minnesota about that law, and I'll talk about that a little bit later. So this was like the first couple of weeks, the first couple of months when we were opened in the medical arts building. There were some news articles. We had people protesting both for our clinic opening and against our clinic opening. And so it wasn't uncommon to have protesters. And then they also would come, and the protesters would stand outside of our door. We were on the 6th floor of the medical arts building. And so they would have signs and, intimidate people getting off the elevator. So we finally had to have an off-duty police officer work on the days that we did abortions, at least in the morning, to make sure that there was no problem. So Oneida Realty had to pay for the off-duty police officer. So just a few interesting facts. There was no doctors in Duluth wanted to perform abortions at our clinic, including Dr. Lundberg. All of our doctors came from out of town. We had Dr. Hodgson, who came from St. Paul. We had one Dr. Nix, who came from Chisholm. And then we had another doctor, Dr. Katie Guthrie, who came from Deer River. So they all traveled from out of town. Dr. Hodgson was our medical director. And she had been very active in the abortion rights movement. She was an OBGYN from St. Paul, Minnesota, for those of you who don't know. And she had a private practice, and she ended up doing an abortion in a hospital on a woman who had the German measles. And she told the hospital board that she was going to do it. She performed the abortion, and after she did that, she was arrested because abortion was still illegal. Um, she had a court case. She lost the case. Her medical license in Minnesota was suspended. So she moved out to Washington, D.C., and started working at a clinic called Preterm. And so she had a lot of abortion knowledge. And then once abortion was made legal, then she moved back to Minnesota, and she established working with Midwest Health Center for Women and setting up abortion clinics. And then abortion was what she spent the rest of her life doing. So we were very fortunate to have her. And then she also trained one of our doctors and longtime doctors and medical director, Dr. Carol Ball, to perform abortions in 1981. And Dr. Ball worked for us until she retired about a year and a half ago. When we first opened, we did abortions two to three times a week because of our patient load. So we would average probably around 1,200 abortions a year when we first started performing abortions. And then gradually the abortion numbers declined. And I think some of that was due that younger people were moving out of the area. And so now currently we do about 400, 455 abortions a year. So last year we did actually 464 abortions. And then we came self-sufficient sooner than we expected. And then actually on April 1st, 1983, we became the Women's Health Center of Duluth. So we talked about picketing. That was a common occurrence. We had to hire an off-duty police officer. We lost our lease in 1990 because of the picketing. And then we finally found a place in the old Duluth clinic, which was Arrowhead Place on 2nd Street. So we moved there. Picketing continued in the building, and then there was also some vandalism. There was a butyric acid attack, and then they spilled acid in the first floor of the building, and so that took a while to clean up, and it has a horrific smell. And then also one day we came to work and all of our locks were glued shut, so then we had to get a locksmith so we were able to get into the building. And so we lost our lease because of the harassment and complaints from other tenants in the building. And then in 2008, Tina Welsh, which you all know quite well, she retired as executive director, and then I became the new director. So these are some of the court cases. So in 1989, it was Dr. Hodgson challenged the Minnesota parental notification law. And we argued that the law violated the woman's constitutional right to access abortion. It went all the way to the US Supreme Court. They upheld the constitutionality of the law, but it was amended to include a judicial bypass. So now if a minor wasn't able to notify one or both of her parents, then she could use a judicial bypass. So she would go to court in St. Louis County. And then the judge would decide whether it's in her best interest or if she was mature enough to make the decision to terminate her pregnancy without her parents' knowledge. And then in 1995, it was Jane Doe versus Gomez. We were a plaintiff, and we sued the state of Minnesota because medical assistants would pay for the costs associated with childbirth, but they would not pay for costs associated with abortion. So the US Supreme Court said public funds for childbirth related to, public funds for childbirth related expenses must also cover abortion because you were violating the right to privacy under the Constitution, and also it was a disparity. So Minnesota Medical Assistance now pays for abortion. Granted, we don't receive the full cost of what medical assistance pays. We probably get half of what it costs us to perform an abortion, but at least it was helpful to the women who were on public assistance and were having trouble finding money for the full cost of an abortion. So this was just one of the articles that Dr. Hodgson, she took on the parental notification court case, and then later on, she also was one of the plaintiffs in the medical assistance case. So the Minnesota legislature once again sought to restrict abortion access by passing a statute that prohibited the use of medical assistance to pay for abortion. So the case did go to the Minnesota Supreme Court. And so the Minnesota Supreme Court held that medical assistance statutes that permitted the use of public funds for childbirth related expenses, but withheld funds for services related to therapeutic abortion violated a woman's right to privacy under the Minnesota Constitution. So some of our governance, we had our new articles of incorporation in March of 1983. And so we had a board of directors. And so it was Dr. Ball, Elizabeth Blakesley, Byron Krause, Selma Goldish, Tom Huntley, Bonnie Keeling, Shirley Levine, Mary Martin, George Mix, Kate Pearson, and Lynn Clark Pegg and Heidi Timbiju. Those were some of our original board of directors. And then we changed the structure in 1991. And so we became a physician board with 5 to 7 doctors, and they were the governing entity of our clinic. And then we created an advisory council with 5 to 11 members. So the advisory council would meet monthly and make recommendations to the PA board. And the PA board would meet 4 times a year. And then most of the time they would take up the recommendations from the advisory council. So actually the advisory council did a lot of the work for the governance of the clinic. And then in September of 2015, the board structure of WHC changed and we updated our bylaws, and that was quite a process. So we decided that the board of directors shall be comprised of no less than 7 directors and no more than 15 directors. And then we had a board term of 3 years, and a director may serve 2 consecutive terms, and then they could go off the board and then for at least a year. And then if they wanted to come back on and if there was an opening, then we would reconsider them joining the board again. And so the new board was comprised of community members, and we had to have at least 2 doctors on our board. And so we dissolved the advisory council and the PA board. And so the new board structure, they were the governing entity of our clinic. And I think it was really, really great for the new board members to have like a voting say in how the organization was run, because the advisory council, they would put in all this time and energy, but they really had no vote on how the clinic would be run. It was the PA board that was making all the decisions. So we took the best of both boards, and we made a new board structure. So in 2017 and 2018, we decided to look at our mission statement and look at our just our structure of the clinic again. We had gotten a grant from an organization to provide funding for that. So we hired Aurora Consulting, and they're out of Minneapolis. And so she, her name was Sarah. She led our organization through the strategic planning process. And then we created a new mission statement and a vision statement. And you can see the mission statement we came up with. WHC provides, advances, and advocates for evidence-based reproductive and sexual health care for all. And then also our vision statement was every individual controls their sexual and reproductive health. And so we worked on those statements probably for 4 or 5 months. So it was really time consuming, and there was a lot of wordsmithing going on, but everyone was pleased with the final outcome. So also, because we had gotten this grant, we could also talk about, it was for branding, marketing, and a communications grant also. So when we sent out the request for proposals, a lot of the agencies that sent back a proposal asked us if we were interested in changing our name because they thought our name, Women's Health Center, was somewhat limiting. And the Women's Health Center had talked about that over the years, that a lot of people, thought that we only provided services to women and not males. And then we also, had decided to start providing transgender care. So we said, yes, include that in your proposal. So during the strategic planning process, the board of directors, staff, and we had different community members discuss the possibility of changing Women's Health Center name to be more inclusive of the individuals we serve. So we hired out there advertising in 2018 to generate an awareness of our clinic and to communicate the range of health services offered to the community, also to enhance the community perception of WHC and its role in the community, and help facilitate a name change for our clinic. Because a lot of people, when they hear Women's Health Center, they would just think, oh, that's the abortion clinic. That's all they do. But we do a lot of other things, as you'll see in the presentation. So our goal of the goal was to change our name. So in 2019, we changed our name because we wanted to be welcoming to all genders, and we were providing gender affirming hormone care starting in June of 2018. And then also we wanted to just maybe differentiate our name from the Women's Care Center, which is across the street, because a lot of times people would get confused where they were going. And the Women's Care Center, for those of you who don't know, is a crisis pregnancy center. So they are not supportive of abortion. So in May of 2019, we officially changed our name to We Health Clinic PA. I think from the community, the response was overwhelmingly positive. Not everyone was on board with our name, but I think it's grown with people over the years. And even a few staff people really didn't like We Health Clinic. But myself, I like it. So we got a new logo. We got a tagline, Together for Health and Choice. So we're very happy that we changed our name. So some of the challenges that our clinic faces, we have the Crisis Pregnancy Center across or kitty corner across from our clinic, and they're also known as fake women's health centers. Crisis pregnancy centers, they use deceptive websites. They have misleading advertising. They use dishonest tactics to manipulate people into believing they're an actual reproductive health clinic. They intentionally mislead pregnant women about their healthcare options. They deliberately try to delay people when trying to access abortion by telling them lies and misinformation about reproductive health. And they give women false, incomplete, and inaccurate medical information, claiming that abortions pose health risks, such as infertility, breast cancer, and birth defects in future pregnancies. They'll sometimes not tell women exactly how far they are in the pregnancy. They might give them an inaccurate date. So then if a woman thinks she's earlier in the pregnancy and she's really not, she might be too far to have an abortion at our clinic or even just in general. So, we try to warn people about the Crisis Pregnancy Center when they make appointments and tell them, that don't go to the place with the bright pink awning. You have to come to the building for women. You need to walk upstairs, or you can take the elevator so that you know that you're in the right place. And in Minnesota, there's 93 crisis pregnancy centers. And in the United States, there's over 2,700. And when you compare that to the number of abortion clinics, in the United States and actually Minnesota, that's quite a big difference. And some of the crisis pregnancy centers in Minnesota also get funding through the Positive Alternatives grant through the Minnesota Department of Health, just so you know that. But that's a picture of the building across the street. So we also have protesters. They come. We have one group that comes 2 to 3 times a week. We have another group that comes on Tuesday mornings. Their goal is to intimidate, harass, and shame people from entering our building. The bottom picture where it says Building for Women, that's a picture from one of the January anniversary dates of Roe v. Wade. So they usually have a big group that protests on that day. Pro-Life Action Ministries is the group that comes 2 to 3 days a week. They have a Facebook page, so they put things on their Facebook page. They take pictures of our patients and our escorts. We have one protester that comes and he stands outside of our building and he screams at the top of his voice. So he disrupts services within the building. It's hard for the PABS organization sometimes for their staff to work because his screaming is so loud. His screaming also interferes with our staff. Sometimes a couple weeks ago, the nurse had a hard time even taking a medical history from the patient because his screaming was so loud. So we do call the police. The police come and they tell us there's nothing they can do because it's First Amendment rights. So we're trying to figure out how we can deal with this because he's really disruptive. And then also the protesters will stand in the parking ramp. And so when people get out of their car, they'll follow them and they'll try to talk to them, hand out literature. And if they have a big group of people, sometimes there might be 10 to 12 people protesting on a day. They'll form like a little tunnel. So then people have to walk through that tunnel to actually get onto our property. We tell patients when they make their appointment about the protesters. And then we also tell them that they can get dropped off in our parking lot in the back. We have a small parking lot. And so if they have a ride, we really encourage them to just get dropped off. So that way they don't have to walk through the picketers. The protesters also will stand in back by the parking lot. And sometimes they'll stand in the middle of the alley and they don't move until you actually, start driving towards them. Then they'll finally get out of the way. But we have a really great group of dedicated clinic escorts. They're all volunteers. And so they will provide a welcoming face. They'll walk people into our clinic. They'll also walk people back to their cars after they have their abortion. And so a lot of them are UMD students. And then we have also a group of dedicated men and women who are retired that come and help also. And then the little peep, I like peeps and I thought that was cute. So I'm probably one of the few people in the world that loves peeps. So I just thought I had to put that in because I thought it was so cute. So, and then financially, that's another challenge for both our clinic and for women accessing abortion. So the most common thing that we hear from women for not continuing a pregnancy is that they don't have enough money to care for a child or support another child. And then also there was a study, it was called the Turnaway Study, and we participated in that. That was probably, I don't know, in the like 2013 to 2018 or something, where if you couldn't have an abortion clinics kept track of that, and they asked the patient if they wanted to enroll in the study, and then the study would contact them like every year to see how they're doing. And they found that many women were already experiencing poverty, and the ones that were turned away and they had to continue the pregnancy, they were still in poverty and they would have a hard time getting out of poverty just because it's a vicious cycle and they didn't have the resources to get out of poverty. And then also, funding for abortion, the Affordable Care Act prohibits states from including abortion in any essential benefit packages. So like if you wanted an abortion and you were considering buying health insurance through the healthcare exchange, you would have to buy a separate policy that would cover abortion. So Minnesota insurance plans are allowed to exclude abortion coverage. So we do see quite a few plans that don't allow abortion even today. Minnesota Care, which is an arm of the Medicaid program, they do not pay for abortions. Medical assistance will, but Minnesota Care won't. So then the women that are on Minnesota Care that are pregnant can apply for medical assistance, and they would probably be covered under medical assistance because of the guidelines, or else they have to come up with the money to pay for the abortion. And medical abortion, I briefly touched on that, doesn't pay for abortion, the full cost. So it affects our cash flow. Sometimes the payments are delayed. So it can take at least 90 or more days to get paid. And then the reimbursement rate is so low. But we are committed to serving, everyone in our area to provide reproductive health services. So we just end up eating those costs. So some of the services that we have, we do abortions up to 15.6 weeks. Those are in-clinic suction abortions. We also provide the abortion pill up to 11 weeks in the pregnancy. We do wellness exams and pap smears. We also provide LGBTQ plus health services, gender affirming therapy, sexually transmitted disease testing and treatment, including rapid HIV and rapid syphilis, vaginitis, urinary tract infection testing and treatment, PrEP, which is pre-exposure prophylaxis for HIV prevention. So you take medication to prevent HIV. We provide contraceptives, including IUDs and implants, emergency contraception, ultrasounds, pregnancy testing, options education. And then we also have 3 MNsure navigators on staff, so we can help enroll Minnesota residents into a healthcare program. So this is what an exam room looks like on the day that we do abortions. So the machine, like towards the window, that's an actual a suction machine. And then we have a table. We have an ultrasound in each of our rooms. So if the doctor wants to do the abortion under ultrasound guidance, she can do that. I think we just want to make abortion part of mainstream medicine. And a lot of people have this convoluted idea that, we're not really a clinic sometimes, and that we had one patient call us last week and ask, well, what do your procedure rooms look like? Like, are they cozy? Do you have blankets in there? So no, we're a medical facility. They look like a medical exam room when you go to the doctor. So I thought I'd just show you a picture so you have an idea what our rooms look like. And then this is a tray for doing the in-clinic suction procedure. So on the very top, those long rods, those are called dilating rods, and those will dilate the cervix to a certain point. And then a curette, which is a plastic tube, is inserted through the cervical opening into the uterus. Then the uterus is cleaned up by suction. So this is what a tray looks like. And then the upper left instrument, that's called a manual vacuum aspirator. So if someone's really early in the pregnancy, sometimes the doctor doesn't feel it's necessary to use a suction machine. So she can use the aspirator, and then the uterus is cleaned out by suction very gently, very quickly. And then with either the in-clinic suction abortion with the machine or with the manual vacuum aspirator, a curette is placed on the tip of like the vacuum aspirator or the tubing. And so I just thought I'd show you what a curette looks like. And there's different sizes, there's different shapes. This is a curved curette, but there's straight ones, there's flexible ones, and they go, up to, I don't know, big enough to do an abortion at 15.6 weeks. So these are our patient services. So in 2020, we had 370 family planning patients. We did 464 abortions, which was kind of ironic. We did 232 in-clinic suction abortions and 232 medication abortions. And normally we do more in-clinic suction abortions, but because of COVID, we were encouraging people to have a medication abortion because they weren't spending as much time then in our clinic. And with COVID-19, we were considered an essential business or essential workplace. So we didn't close. We limited some type of patient visits, at least in the beginning. But we kept performing abortions. We had to change some of our policies and protocols, and some of the changes were great. And I think after COVID, if it's ever done, we'll continue with those changes. So yeah, it was a whole learning experience um, since March of last year. Currently, we have 35 hormone therapy patients. We dispensed 8,500 condoms last year, 125 units of emergency contraception that we give away at no charge. We did 65 IUDs and 24 implants, which is the next Nexplanon. And then also because of COVID, we implemented a telehealth option for our family planning services. So our doctor who does our family planning services is Dr. Judith Johnson. She's an OBGYN. She joined our clinic staff in 2018. Previously, she had been a staff doctor at St. Luke's OBGYN, and she had served on our board for many, many years, and she decided she was ready to start doing abortions at our clinic and providing family planning services. So we are so happy that we have a local doctor finally to provide services. And then we also last year, even though we had COVID, we did 76 enrollments for MNsure. And then we also helped 158 individuals. So like if they called us and had questions, we could walk them through the application and just give them advice on that. So for our hormone therapy, we provide gender affirming hormone healthcare. So feminizing and masculizing hormones. And then we also monitor adults. We also give information and referrals for gender affirming surgeries, speech therapy, and cosmetic procedures, and then post-surgical follow-up. So we don't do any surgical procedures at our clinic for hormone therapy care, but we will do follow-ups for people who like might go down to the Twin Cities to have some type of surgery. And so the little graph on top, it's kind of hard to see. So our patients have increased from 2018. So the first year we saw 21 patients, then we saw 33, and then 35. The age range is anywhere from 18 to 76. We won't see any individuals under the age of 18 for hormone therapy. So we have currently in 2020, we had 20 people who are using feminizing hormones. So that's male to female, and then 15 for female to male. And then we also just see other non-binary transgender patients for services like STI testing. They might need an exam of some sort and they're not comfortable going to their doctor. So we'll also provide care for those individuals also. So our abortion statistics, as you can see, for the last 3 years, we did 110 medication abortions in 2018 and 266 in clinic section abortions. And then in 2019, our medication abortions went up a little bit. And then in 2020, they really jumped. So that was significant. And I think that's probably happening all over the United States because of COVID, that people are choosing to have medication abortions over in-clinic section abortions right now. So these are really small. I can barely see them myself. So I have a piece of paper I can read from. So the race, our most common race is Caucasians. So of our 220 abortion statistics, we saw 337 women who were Caucasian, 26 who were African American, 62 who were Native American, 5 Asian women, 2 Eastern Indian, 6 Hispanic, and then people that indicated 2 or more races, it was 26. Most of our people have had some type of high school education, and then we have people who graduated from college. We have more single women having abortions than married women. We have more women who have had children than not have children choosing abortion. Um, let's see, we had 170 women who have had a previous abortion versus 294 people who have never had an abortion prior to their first abortion at our clinic. So we have more women using Minnesota medical assistance to pay for abortion, and then people who pay out of pocket. And then private insurance, we only had 24 people last year that used insurance. And then we also are very fortunate that there are some abortion funds in Minnesota and Wisconsin that'll help fund women having an abortion. So 106 women, or I'm sorry, 108 women choose to get funding from the different abortion funds. The most common age breakdown is the 22 to 25-year-olds, and then it's the 26 to 29-year-olds. You know, on a given day, we could have everyone that's in their 30s, or we have some people that are in their early 40s. I think it's a really misconception that it's all minors or teenagers having abortions, because that's not true. Last year, we had 17 minors, and out of those 17 minors, 7 of those chose to use the judicial bypass system. So that's not a large number. And then with COVID-19 now, we are also doing our parental notification hearings over Zoom, which has been nice for, I think, the judges and for our staff and our patients. And in St. Louis County, there are certain judges that'll hear our parental notification hearings. Some judges have said, no, I don't want to hear them. The law states that the courthouse should hear cases 24 hours a day, 7 days a week, but we all know that doesn't happen. But we have a really good relationship working with the court administration and the judges. So we're very fortunate. We do things a little bit differently at our clinic and in St. Louis County than they do in Minneapolis. In Minneapolis and St. Paul, it's up to the patient to try to arrange the court hearing and to get to the court hearing. And our clinic does everything up here. We contact the court administration, we contact the judge. We really tell the minor and her parent or parents, depending on who's coming with, what to expect. And the judges that hear our parental notification hearings are very compassionate. They're very kind. They really try to put the minor at ease, because a lot of times the minor has never been in front of a judge before, never had any dealings with the court. So they're really nervous. They don't know if the judge is going to approve of their abortion decision or not. So we try to give the minor as much information ahead of time as we can to make the situation as best as it can be for them. So financially, our sources of funding are through patient fees, some private insurances, medical assistance, abortion loan funds. We get paid if we enroll people into a qualified health plan or Minnesota medical assistance or Minnesota Care. And then we also get some grants from foundations. And it's really difficult sometimes to find grant funding for our clinic just because we do abortion. So a lot of times we don't qualify for some type of grant funding just because of the abortion issue. And then we also get donations from private individuals, which really is great. It makes up quite a bit of our budget. And then in 2020 and also in 2021, we were also eligible to receive some of the PPP funding from the government, which was really a godsend, because I don't know what we would have done if we hadn't gotten that funding to help tide us over, during the COVID. So lastly, the Building for Women was created to help us find a permanent home because we kept getting evicted. So in 1993, we were told that we were losing our lease in Arrowhead Place and it wasn't going to be renewed. So Tina Welsh and Rosemary Rocco, they organized a community meeting of 22 nonprofit women's organizations to ask if any of the organizations wanted to joined forces to buy a building and to move their offices into the building for women so we could have a permanent home. So PAVSA and the YWCA joined WHC to buy the building that we currently are housed, and we came up with the name Building for Women. So Women's Health, or We Health Clinic, and PAVSA are the general partners of the building, and we each own 40% of the building, and the YWCA is a limited partner, which owns 20%. PAVSA and our clinic make all the decisions regarding management of the building, and also we are financially liable for the building. The YWCA is a limited partner, so they don't get a say in the decision making, but we do ask them, what they think about certain decisions, and they're also included in our partnership meetings, but they have no financial liability. So Tina and Rosemary started a capital campaign to raise $3 million. And at the time, like in 1993, 1994, the head of the Duluth Catholic Diocese, Bishop Schweitz, he started a public campaign to urge funders not to provide financial support to the building for women. And some of that was successful because the building was counting on a few grants from national organizations, and they ended up not getting them because of Bishop Schweitz and his campaign. So the upper one on the right, that's what the building looked like when we bought it. And the lower left, that's what it looks like now, minus the flags. The flags keep getting blown down. So we are in the process of trying to get new flags. And then those are just the logos of the three partners for the building. Again, a before and after picture. So when we first moved into the building, we didn't have the plaza. So they constructed a wooden catwalk so we could have access to get into the building. And then the tower on the right, that was an addition to the building. So that's the stairway to get up to the third floor and go down to the basement. So that was a new addition. So the building looks a lot better now. Our fence doesn't look this good right now. We only have partial fence. It was removed because it wasn't looking great. So We Health Clinic has received a grant, so we're getting a new fence, and hopefully it will be installed, let's see, by the end of May. So that'll help. And I think it'll help with the picketers too, because right now we just have one section of the fence. So people have driven onto the plaza, which the plaza is not structurally built to have cars and vehicles on it. So that fence will hopefully help stop that type of behavior. And then also it'll be another boundary for the protesters. And we named the plaza Dr. Jane Hodgson, just after Dr. Hodgson, because she was such a large part of our clinic and also of our building. So these were just people over the years. Dr. McCreary, she's the one on the left. Dr. Johnson, I'm sorry, Dr. Mix, Dr. Hodgson, and Dr. Ball were below. And then these were people on our board. Joan Peterson, Prudy Cameron worked here for years, and she was also on our advisory council. Tris Harwood. And then these were people for the Building for Women. Phil France, Ruthie Frederick, let's see, Marge Whitney, I believe, Mary Ellen Owens, Hami Cantor, Betty Ramslin. So those were some people. And then there's Tina. I think that was for her retirement. Yeah, that picture is from her retirement party. And then these were just rallies when we first opened up. We had pro-choice rallies. And then also when we moved to Arrowhead Place, the one on the top, that was another anniversary date of Roe v. Wade, when they would protest in front of Arrowhead Place. These were just some of the brochures that we've had over the years. So, showing how things change. So it's kind of fun to look at, all of the history. And then this is it. So, I really appreciate you inviting me and letting us tell our 40 years of history. And then I can answer any questions if you have any questions.